Not your health.
Yeah, that too, yeah.
That was bad. To learn some things about your health, okay? So I'm going to start out by asking a question. How many of you ever known anybody that got some sort of infectious disease, some sort of infection, could have been anything, and never really got over it? Just never could kick it. Anybody?
I do. Had a wife.
Yeah, it happens.
Yeah.
And that's what we're going to talk about tonight. We're going to talk about stealth pathogens and how they destroy our health. This is a really important topic because there's a lot of people in our culture that suffer from this stuff that don't know what to do about it. So what is a stealth pathogen? Any pathogenic microorganisms that basically evades the immune system and leads to any chronic disease, ill health, and does not respond to medication. Have you ever heard of people that are ill that don't respond to medication?
Yeah.
It happens all the time.
Yeah.
Okay. Yeah. And so that's what we're talking about. This is Professor Terry Bone. Probably knows more about herbal therapy than any human being in the world. He's from Australia, and the MediHerb line that I use is his creation. Okay. So stealth pathogens can include a lot of things: bacteria, molds, yeasts, viruses, spirochetes, and parasites. Okay, there's a whole array of things that can cause problems. Now, here's some of the symptoms of a stealth infection: fatigue, insomnia, anxiety, muscle pain, cognitive impairment, weight gain, recurrent infections, general poor health. And stealth pathogens have been linked to a wide number of health conditions, and here's some of them. Okay, autoimmune for sure, chronic fatigue, fibromyalgia, cancer, Lyme disease is definitely a stealth pathogen. So I'm going to ask you a question. What would cause somebody to acquire a stealth pathogen and not be able to get over it? What would cause that? Anybody?
Blood problem. Blood, let's say they don't have enough white blood cells.
Or immunity.
Poor immunity.
Poor immunity, yeah.
Poor immunity, okay. So what causes poor immunity?
Diet.
Okay, what about diet?
Sugars.
Too much sugar. Okay, it's always an answer to one of my questions.
The wrong sugars.
The wrong sugars, okay. What else? What else about our diet?
Too much alcohol, too much cigarette smoking.
Fast food.
Bad.
Yeah, too much processed food.
Maybe too much.
How much nutrition is in a bag of Cheetos?
Hey.
I mean, if you
Easy there.
were dying of starvation, that might work for you.
Yeah.
But that's about it.
There you
Okay.
go.
They'll keep you alive, but they won't keep you healthy.
No.
Okay. And so, so just our culture where between 60 and 69% of most Americans' diet is ultra processed food. That's why when they get sick, sometimes they can't get over it because they don't have the immune capacity to do it. Okay, and so people that have strong immune systems generally don't get this stuff. Okay, generally not. All right, so autoimmune diseases associated with stealth pathogens. Some of you have heard of this, ankylosing spondylitis, Crohn's, and I'm seeing more and more GI disorders that are hooked into stealth pathogens that are being caused by that. Type 1 diabetes, Graves' disease, multiple sclerosis, rheumatoid arthritis, psoriasis. How many physicians would ever treat MS like a pathogen? Not many.
No.
Okay, not many. Sjogren's syndrome, lupus, ulcerative colitis, and hypothyroidism. All they all have they can all be connected to a stealth pathogen. Now, with stealth pathogen, your body has been hacked by a pathogen that can evade the immune system. It's able to do it. This could come from past infectious diseases that were totally not eradicated. Okay, so food poisoning. Some of us have had that. I've had it. Okay, got it real bad when I was in Haiti decades ago. Montezuma's Revenge, which basically is another form of food poisoning. Parasites picked up in foreign countries. That happens more often than what you think. Where else can you pick up parasites?
Right here.
Out in the woods.
Yeah, we pick them up here. I mean,
Yeah.
people's dogs and cats have parasites.
Please.
Yeah. Bouts of mononucleosis. You know, when I see like these 7th and 8th grade girls getting mono, that's a problem. There's an immune issue going on with them, and they shouldn't be getting that. Chronic diarrhea. How about bug bites that cause a chronic issue? Anybody ever seen that before?
Yeah.
Like you
Spider
get
bites.
bit by a mosquito or something,
Spider.
yeah, it's something, and then it just creates this kind of never-ending process. I have a patient right now that's dealing with that I'm working with. So it could be a lot of different things. And so one of the questions I ask people, and I ask all of my patients, especially patients with chronic GI issues, is have you been to a foreign country in the last 10 years, especially a developing country, third world country? It's easy to get things there. I mean, I was just talking to my brother last week in California. He's an airline pilot, and he used to do layovers in Mexico City, and he said one time he went to a really fancy restaurant there, and he ate a salad, and I guess within a day he was sick, and it took him months to get over that. And he said, I avoided layovers in Mexico City after that. But these things can get a hold if you're not healthy, and they can just cause problem after problem after problem. So how do we naturally eradicate these critters? Well, we use what's called the stealth pathogen protocol. So these are very specific herbal formulas. So why could we use herbs, and why wouldn't antibiotics work? Why wouldn't antibiotics work? Anybody?
It's a wrong antibiotic. Some are gram-positive, some are gram-negative. Type of bacteria or whatever pathogen, and because of that, the antibiotic doesn't counteract it. My one wife lost her leg because of an infection that traveled up her leg, and they gave her the wrong antibiotic.
And these a lot of these problems that you get from stealth pathogens, they get resistant to antibiotics,
Mm-hmm.
and they develop these what are called biofilms, which are like critter apartment complexes that are really hard to penetrate. Antibiotics won't penetrate a lot of that type of thing. These biofilms are just these films that are filled with bacteria, and they're really hard to penetrate, and most drugs will not do that. Okay, so that is a problem right there. So when you give somebody antibiotics persistently over time, the pathogens or the bugs, they get resistant to it. They don't respond to
You
it.
laugh at it, yeah.
So this protocol works pretty well. Now let's look at where we get these. Let's look at myrrh forte. Myrrh comes from a tree, the stems of a tree in Africa called myrrh camophora. it's secreted like it's a resin. It's secreted. It's sticky, and so myrrh is very powerful. It's antimicrobial, antiparasitic, anti-inflammatory, and it's a vulnerary, which means it's a remedy for wounds. Now, I had a patient come into me today, an individual that they said they had a tooth infection and they wanted something natural to fight it off. This is what I gave them. Gave them myrrh, okay? So if they chew that and they get that in their mouth, that's even gonna help more, okay? Clinical studies suggest using high doses for treatment of parasites that infest deeper in the body. And you know, at Christmas time, we all know the wise men came to Jesus and they gave gold, frankincense, and myrrh.
Yeah.
Myrrh is a powerful antibiotic, and it's not cheap because it's hard, like getting it, like scraping the resin off those trees is sort of a labor-intensive process, and then processing it so you can take it. Other uses of myrrh include mouth ulcers, gingivitis, laryngitis, colds, bronchitis, diarrhea, gut, liver, and bladder parasites, boils, and abscesses. So you could take this orally, or you could crush it up and make a paste and just put it right on it, and it will work. Artemisinin. So artemisinin is, the common name is sweet wormwood. Now this isn't the same wormwood as the wormwood that you take as an anti-parasitic, okay? Even though artemisinin has anti-parasitic qualities, it's not the same thing. Historically, it was used to treat malaria. And, malaria is a spirochete that comes from, mosquitoes, the Anopheles mosquitoes. And so in the 2015 Nobel Prize in Medicine was won with this I think this guy was Korean, Tu Yu or Yo-Yo, whatever, for the effects against malaria. So what we do in my office is we'll put people on these for 4 days, both of these for 4 days. And then we'll take them off for 4 days, and we put them on these two for the next 10 days. So it's a 2-week rotation. That way, the bugs don't get resistant to what we're giving them. So if we look at like artemisinin is really good for longevity, hemorrhoids. It induces hair growth, good for lice, boils, fevers. It's an anti-tumor and anti-cancer compound. So it does a whole lot of different things. So we put them on myrrh and artemisinin to start out with for 4 days. And then, by the way, artemisinin also includes sarsaparilla, which is used in Europe in the late 1400s against syphilis, which had a real problem in Europe with that at that time. It cleanses blood, it's anti-rheumatic, anti-inflammatory, and decreases symptoms of bacterial die-off. So what about Viridon? So the first 4 days with those two, myrrh and artemisinin. The next 10 days is Viridon and echinacea. So Viridon contains 3 antiviral herbs. Now, if I suspect that the stealth infection is yeast or bacterial, I won't use this. I'll use something else. Okay, this is only if I suspect it could be a virus. So St. John's wort, very, very antiviral. Works very well against herpes, and it's most people think of St. John's wort as sort of your natural mood enhancer or your natural SSRI, but it's St. John's wort is very, very antiviral. So if you're taking it for mood, you're going to kill any viruses that are lurking in your body as well. It also contains high-grade licorice, also effective against viruses, effective in herpes simplex virus, encephalitis, and influenza A pneumonia. Here's the good thing. It supports gut barrier integrity and healing. So this protocol is also very good for gut issues, especially gut issues caused by stealth viruses. And licorice is really good for adrenal function, which a lot of people have adrenal issues. By the way, what do the adrenal glands do? Anybody?
Cortisone.
They produce cortisol, so they very anti-inflammatory. Okay, what else do the adrenal glands do? Anybody remember? They produce all our sex hormones.
Oh.
So testosterone, estrogen, pregnenolone, DHEA, the whole gamut of sex hormones. They're our backup system for that, which is really important as we get older in life. And certain other parts of our bodies don't work quite as well as they used to. Okay, Thula, traditionally used for wart viruses. Again, this is part of Viranon. Again, effective against viruses, contains essential oils, can be applied topically, antimicrobial and antifungal. Okay, and finally, echinacea. How many of you in here have taken echinacea? Okay, echinacea is a very, very powerful immune stimulator. And it stimulates against bacterial, viral, and fungal infections, like yeast infections, okay? So if somebody comes in and I test them and they've got a yeast infection, normally I probably would not give them Viranon. Does anybody know which herb or which plant is pretty effective against yeast infections? Anybody know? Yeah. Do you know, Wayne?
No.
Oh, okay. I thought you were raising your hand. Okay. Okay. All right. I won't call on you again. Garlic. Garlic is powerful anti-fungal and anti-yeast. So what I would do is, if I suspect they've got a yeast infection, I would probably give them myrrh, artemisinin, garlic forte, and echinacea, and that would work pretty well for that. Now, what about mold? What do you do with mold infections? Anybody? Because mold can cause lots and lots of problems in the body. So how do you deal with that? Anybody know? It's actually easier than using this. So with mold, what I do, and I don't even carry these products, I use activated charcoal, okay, and
bentonite clay.
Bentonite clay, thank you. It just slipped my mind. So bentonite clay, which when I worked in the oil field, we used to pump down in bentonite clay into the drilling hole to stabilize the formation. But when I got out of chiropractic school, I found out that you could take it internally. It's a very powerful detoxifier. So bentonite clay, and we alternate bentonite clay with activated charcoal, and that's what I use for mold. Then you might want to use something like GI stability or GI absorb, sort of pull things out once you kill it. But that will work quite well for mold, and it's an easy protocol. It's not expensive, and it's pretty effective. Okay, so mold is a big issue in our culture, and lots of people have it, and mold can cause a variety of weird, kind of strange symptoms in the body. So if someone's been exposed to mold, and you can test for it, the problem is the test for mold is pretty pricey. There's several labs that do it. You know, we're talking about a test that runs around $600, $700. But you find out for sure, number one, do you have mold and what strain do you have? Because it helps to understand what strain, because there's just different ways to tweak the treatment if you know the strain. So that's a urine test, it's not a blood test. But if, you know, a lot of people have mold issues, and you can never fix a mold issue with a pharmaceutical. You can't fix it with this either. You have to use activated charcoal and bentonite clay, and then something to pull it out with, some sort of fiber. So, garlic can be powerful for mold, fungal, and worm type parasites. You might want to use garlic for mold. I wouldn't use it for mold. I would use, but definitely for yeast and fungal infections. So again, this protocol can be mixed and matched depending on what you want to do with it. Usually the total time is 3 months. Sometimes you have to go longer. After 3 months, I would take a break for about a month and just see what happens. And if it's not, the patient's not well yet, and you go back on it again, okay? And it can take time. If that pathogen has been in the body for a long time, and it's set up a whole biofilm community, it may take some time to get rid of that. So you have to be really patient with this. Here's another thing: if the patient is really, really sick, and this is probably that's probably too much to start out with. You might only be able to start out with maybe 1 myrrh a day and 1 artemisinin a day, or maybe sometimes even less. Okay, if they're really sick, because once you get a die-off, that can cause problems. So I usually start out with a pretty significant dose, and then if they get, they don't feel well, or they start getting sick because of that, you're giving them too much, and you're killing it off too fast, and you have to back off. Okay, well that went a little faster than what I thought. Does anybody have any questions?
I have a question with I have neighbors that are, let's just put it flatly, they're Mexican. They cook with a lot of garlic, and it really gets the hallway, and it comes into my apartment quite freely. If I just smell the garlic, is that enough to counteract?
Probably not. You need to go over there and eat.
It is so strong,
you need to knock on their door and say, "Hey man,
I go, holy
I want
cow.
some of this."
Yeah, let's have some of that beef roast. Yeah, whatever.
So yeah, I mean, if you take garlic in cloves, like one of the things my wife does is she'll take onions and garlic and ginger and ferment it in honey. And that's a very powerful antibacterial, antiviral concoction. And you can put that in hot tea, you can take it, and it doesn't make you smell like garlic. The honey does something to the garlic where it gets the benefit, but not the smell, okay? I mean, I know people who eat a lot of garlic just because, they want to be healthy and they want to, ward off any pathogens, but not only do pathogens not want to be around them, nobody else does either, that's the problem, so I don't eat a lot of that, simply because I want to have a practice left at the end of the day.
When people stand up,
but yeah, I mean, I guess if you're a hermit, you could eat all the garlic you wanted, and it's very powerful. But no, the garlic product, we have Garlic Forte. The smell has been taken out, so you can take as much of that as you want, and it will not make you smell. And so that's or you can ferment it with onions and ginger and honey, and that's pretty powerful, stuff.
Good. Yeah.
Because honey's pretty antibacterial as well.
So would this treatment help against hidradenitis?
Probably. And I know who you're talking about. Probably, yeah. Yeah. I don't know if I've talked to him about that or not. But because that's a chronic infection.
Yeah, with boils.
Yeah, with
Those
boils and
with
all
boils.
kinds of things, absolutely. So I wouldn't hesitate to use this for that problem at all. I can't remember if he and I have ever talked about that or not. Can't recall. But it would definitely help with that. Any kind of chronic infection that doesn't respond to pharmaceuticals, this is a good protocol for. Good. Anybody else? All right, great. So if you guys know of people who have chronic issues and they might have infection issues, let me know, send them in, and I can talk to them about it, and maybe we can get them going on something that could really change your life and help them. So great, thank you very much. And in 2 weeks, I'm doing a talk on caring for yourself for a lifetime, which is I do about 3 or 4 times a year. It's a great talk for people that want to know about, what does it take to get healthy and stay healthy. We're going to talk about that in 2 weeks. So thank you very much for coming tonight.